periosteal elevator, right? So we're trying to elevate the periodontal tissue from the bone, right, with periosteal elevators. So now we're going to talk about general different kinds of elevators. Elevators are always going to be something that are going to move the teeth in hopes to remove the teeth, okay? So the first one is the 3-4-1 crane pick. So it's a straight pointed pick. This is another one if you want to kind of think about it as a bird. It has a beak, kind of like a bird. It's a crane pick. A crane is a bird, okay? This is going to be used to open space and remove teeth and roots, okay? Elevators are meant to elevate, okay? So this would go in between. So see how it's kind of, it's that like sort of triangular pointed shape. So imagine you want to go in between the teeth. So it's going to kind of fit right in there and create some space between those teeth by kind of moving, okay? So it's going to create space by forcibly moving those teeth out of the way, okay? So that's the point of that one. That's why it has that kind of pointed idea. It's not going to be the kind of like, imagine you, that would be a really weird way to have to orient it to get it in there. It's meant to go between the teeth and start to create space. Elevators just use pressure. So you'll see them kind of moving, twisting and turning, and sometimes up and down. That's what the point of that is. So this one's going to go in between to create that space. 341 crane pick elevator. All right, so next one, we're going to have another east-west paired, okay? So these will be paired, but you're going to need to, I don't know that these are paired. It says that they're a pair, but I don't think they're going to be paired on, no, maybe they are going to be paired.
I don't think they were.
No, okay. So these would typically be together, but we're not going to have them as paired. That makes a lot of sense. So this is going to permit insertion to engage and lift roots. So this is going to be similar to the crane, but this is going to kind of be site specific. So we're going to have a cutting edge again, like we did when we were learning the others, right? The other east and wests. Cutting edge, we're going to hold it looking at us. East will be the lower number, west will be the higher number. In the case of these, it is the 27 east, 28 west elevators, okay? So they're elevators, 27 and 28, 27 east, 28 west, okay? All right, so our next three are going to be the 301, 302, and 303. So remember, all elevators are going in to loosen and try to remove the tooth, okay? The straighter the end, the more anterior. So the 301 is for maxillary roots, okay? Maxillary, anterior, straight anterior maxillary, okay? The 302 and 303 are mandibular roots, okay? So you can see that they're bent. This is another east-west thing, okay? This is what's going to help you to differentiate which is which. So the 302 is the lower number, right? It's pointing east, and the 303 is pointing west. They have this kind of scooped out end all three of these. The idea of these is that they are going to make their way as close to the apices as possible, okay? So it's gonna go, that's why it's kind of just like straight and scooped. You wanna imagine that it's gonna go right down the root to the tip, and then it's gonna try to be forced up, okay? All right, so that is surgical tray 2-2.